where a lot of people have coverage, but nobody has a place to go because their deductible's so high, or in Medicaid where people are covered, but doctors increasingly don't want to take Medicaid patients. Those are the kind of problems we ought to be solving.
Senator Roy Blunt was on Meet the Press yesterday. Now joining us is Stephen Roberts, ABC News political analyst. Good morning, Stephen Roberts.
Hey, good morning.
How much trouble? Let me ask you this question. It seems like the parties passed two different bills, and you ask them the same question, and you get two different answers.
Well, that's because there are two very different political calculations. For the Republicans, they felt very strongly that they had to keep a promise. They had to pass something. They had been saying for years that their number one priority was to repeal and replace Obamacare. Trump campaigned on it. Many other Republicans did. So did Senator Blunt. And so they felt after the embarrassment of a month ago where they couldn't even get enough votes to pass a bill in the House that they had to do something. Part of the calculation is you go into an off-year election and the vote totals are always down from a presidential year. You got to depend heavily on your base to turn out. They didn't want a lot of disillusioned Republicans staying home. On the other hand, having passed this bill, it's got a lot of political vulnerabilities. Senior citizens, for instance, would see their, particularly between 50 and 64, if you have pre-existing conditions, could see their premiums skyrocket. The AARP, the lobby for elderly Americans, is furious with this bill. A lot of Republican governors in states like Ohio, Michigan, very upset with the bill because it would reduce their ability to expand Medicaid to a lot of their constituents. So the Democrats say, look, we've got a real opening here. A lot of these Republicans who voted for this bill, in the words of Nancy Pelosi, the Democratic leader, will glow in the dark in the next election and are prime targets. And the ads are already being written to attack these Republicans. So both sides, the reason why there's such different views here is it depends on which political calculation you're making.
Stephen Roberts, I got a sense, just sort of listening between the lines over the last couple of days, that the House basically said, we're tired of dealing with this. Let's just get anything across the finish line, give it to the Senate, and give the hot potato to the Senate Republicans.
I think that's largely right. As I say, they were very frustrated and embarrassed by the fact that they weren't able to pass anything, and in the first months of a new administration, you think it's going to be a honeymoon, that you have extra political clout. It was very embarrassing for them to not pass anything because it raised the whole question, do Republicans know how to govern? Are they really even capable as a party of getting anything done now that they run all the branches of government? So there was a very important symbolic impulse, and they only passed it by 4 votes. And it was an act of desperation. But when you get down to the substance of this bill, it does provide a lot of targets for Democrats. Democrats have several advantages here. One is that in off-year elections, after the election of a new president, the out party almost always picks up seats. So they have history on their side. There are more than 20 congressional districts occupied by Republicans where Hillary Clinton won the presidential vote. So these districts, clearly the Republicans are vulnerable. Democrats only need to pick up 24 seats in the next election to retake the House. So Democrats are very energized, and they have the advantage now of being the party of no. They can be unified around one idea. Let's hurt Donald Trump. Let's oppose Donald Trump. It's the resistance, as Hillary Clinton called it the other day. It's easy when you're the out party to organize around the simple proposition of saying no. That's what Republicans did for years against Barack Obama. And so the Democrats do feel energized in terms of the next election, but they're going to run into a huge problem, McGraw, which is that Republicans have shrewdly and carefully built majorities not only in state legislatures, but held a lot of governorships. That means that the Republicans in state after state have controlled the redistricting process for years. And the ability of Democrats to win a lot of seats in the next election going to really run into the obstacle that a lot of potentially vulnerable Republicans represent districts that were very carefully crafted to protect them.
Stephen Roberts, I got about 30 seconds here. It seems like Donald Trump wants single-payer and universal health care. Every time he speaks, including in front of the Australian Prime Minister, he talks about wanting single-payer or being enamored by single-payer.
I think that's true, and it's just one of many examples that show you that Donald Trump in no way is an orthodox Republican. He's a Republican from out of convenience. The truth is, he's out of step with a lot of basic conservative orthodoxy, which is why a lot of conservatives did not support him during the election. The truth is, Trump doesn't belong to any political party. He's a Trumpian, and he does not have a lot of fully formed and deeply held political views, and we're seeing that over and over again. He switches ideas very quickly, and he is very liable to embrace an issue like single payer, which is totally anathema to his conservative base. But that's Donald Trump.
There you go. Stephen Roberts, have a good week. Thanks for checking in.
Okay, pal.
Sunday is Mother's Day, and it is, dare I say, the mother of all flower days. And so where are you going?